Welcome to the deep dive. Today we're tackling something that really touches so many lives, anxiety disorders.
It really does.
We've got a really solid stack of information to unpack here, drawing from, the clinical authority of Mayo Clinic, some in-depth research from PMC, and also insights from Psychology Today and Very Well Mind.
A good mix.
Yeah, exactly. Our goal in this deep dive is basically to cut through the noise, get to the heart of how these disorders are identified, and, maybe more importantly, what the main ways to manage them actually look like, so you get a clearer picture.
And it's genuinely eye-opening just how common this is. The National Institute of Mental Health Estimates in Very Well Mind mentions this, that something like 19% of U.S. adults deal with anxiety each year.
19%, wow.
Yeah, and for adolescents, it jumps to about 31%.
Goodness.
Those numbers really, really highlight why understanding these conditions and, how to approach them is just so vital.
Absolutely. So, okay, if someone suspects that, what they're feeling is maybe more than just everyday worry, what's the first step? How do you figure that out? Mayo Clinic points to starting with your primary care doctor.
Yes, that's usually the recommended first stop. Think of them as like the initial checkpoint.
Okay.
They can help rule out any underlying physical health stuff that might be mimicking anxiety symptoms or contributing to them. You want to make sure it's not, a thyroid issue or something else medical first.
Right. Rule out the physical causes. Okay. So if the primary care doc says, nope, not physical, that's when you look towards mental health specialists. Mayo Clinic mentions a few different types.
Exactly. That's when professionals like psychiatrists or medical doctors specializing in mental health or psychologists, clinical social workers, other licensed therapists, they have the specific training needed.
To diagnose and provide therapy.
Right. To diagnose accurately and provide counseling or talk therapy.
Okay, so you found a specialist. What do they actually do to diagnose? What methods are used? Mayo Clinic highlights a couple of key things.
Well, the first big one is a psychological evaluation.
Okay.
This is really a deep conversation about your thoughts, your feelings, your behaviors. It gets detailed. And it needs to be, because as Mayo Clinic notes, anxiety often doesn't travel alone. It can occur alongside things like depression or substance misuse.
So it can be complicated to untangle.
It can be, yeah. That co-occurrence makes the diagnostic picture sometimes a bit more complex.
That makes sense. And the second method Mayo Clinic mentions, comparing symptoms to the DSM-5 criteria. What exactly is the DSM-5?
Right, the DSM-5, it stands for the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It's basically the standard classification manual used by clinicians in the U.S.
Like a guidebook?
Pretty much, yeah. Published by the American Psychiatric Association, it gives a common language and, crucially, specific criteria lists of symptoms, duration, severity for diagnosing mental health conditions, including all the anxiety disorders.
Got it. So it provides consistency in diagnosis.
Precisely.
Okay, so let's say a diagnosis is made. What happens next? What are the main treatment paths? Mayo Clinic suggests two primary approaches, usually.
That's right. The two sort of main pillars are psychotherapy, talk therapy, and medications.
And often used together.
Very often, yes.
Yeah.
A combination approach is frequently the most effective. But, and Mayo Clinic points this out too, finding the right combination or the right specific therapy or medication, that can take some trial and error. Everyone's different.
Makes sense. Let's dig into psychotherapy first then, talk therapy. Mayo Clinic, Psychology. Today, they both really stress how effective this can be. What's the core idea there?
Well, fundamentally, psychotherapy is about working with a therapist to reduce your anxiety symptoms, yes, but maybe even more importantly, to build practical coping skills for the long haul.
Skills, okay.
Yeah, and Psychology Today puts it nicely. It's about empowering you, giving you back a sense of control when anxiety feels like it's taking over, building that internal resilience.
And within psychotherapy, one type just keeps popping up everywhere. Cognitive behavioral therapy, CBT, Mayo Clinic, PMC, Psychology Today, Very Well Mind. They all highlight it. Sounds like the gold standard.
It's very widely seen that way.
Yeah.
Yes. It's often considered the most effective form of psychotherapy for anxiety disorders. Definitely a first-line treatment.
And what's the main focus? How does CBT work for anxiety?
The central idea, which all our sources agree on, is targeting those unhelpful patterns, maladaptive thoughts and behaviors that actually maintain the anxiety cycle.
Okay, so thoughts and behaviors. Can you break that down a bit? What does that look like in practice?
Sure. So a huge piece is what the PMC article in Psychology Today called cognitive restructuring.
Right.
This means learning to first identify and then challenge those negatively skewed thoughts, those cognitive distortions,
Hmm.
thinking craps like black and white thinking or catastrophizing.
Jumping to the worst conclusion.
Exactly. The goal isn't just think positive. It's more about developing a more realistic, balanced perspective, looking at the actual evidence for your anxious thoughts.
Okay, so catching those negative spirals and reevaluating them. The PMC article also mentioned behavioral experiments. What's that?
Behavioral experiments are, well, pretty much what they sound like. They're planned activities where you actually test out your anxious beliefs in the real world in a safe, structured way.
Give me an example.
Okay, so someone with social anxiety might strongly believe, if I speak up in a meeting, everyone will think I'm stupid. A behavioral experiment might involve them preparing one small comment, saying it, and then actually observing the real reactions rather than just assuming the worst. It's about gathering real-world data to challenge the belief.
Ah, I see. Directly testing those anxious predictions. Very practical. Now, another huge part of CBT seems to be exposure therapy. All the sources mention this too. What's the logic behind that?
Exposure therapy is really key for many anxiety disorders, especially phobias and OCD. The core idea, as PMC explains, comes from learning theory. When we avoid things we fear, it temporarily reduces anxiety, but long-term, it reinforces the fear.
Makes the fear stronger.
Exactly. Exposure therapy breaks that cycle. You gradually and systematically confront the feared situations or objects without doing those safety behaviors you normally rely on.
So you face the fear.
You face the fear in a controlled way, and your brain learns through direct experience, okay, this situation isn't actually dangerous as I thought, or I can actually handle this feeling of anxiety. It leads to what's called extinction learning. The fear response lessens over time.
And Veryl, mine breaks down a specific type, systematic desensitization. How does that work?
Right. Systematic desensitization is a very structured form of exposure. It usually involves 3 steps. First, you learn relaxation techniques like deep breathing or muscle relaxation.
Okay.
Second, you and your therapist create an anxiety hierarchy, a list of your triggers, ranked from least scary to most scary.
Like a ladder.
Exactly, a fear ladder. And third, you gradually work your way up that ladder, exposing yourself to the triggers, starting with the easiest ones, while using those relaxation skills to manage the anxiety.
Step by step.
Yeah.
Mind also mentioned different kinds of exposure, imaginal, in vivo, virtual reality.
Yeah, different ways to do it. Imaginal exposure is vividly imagining the feared situation. In vivo exposure is facing it in real life, like someone with a dog phobia actually being in the same room as a calm dog.
Okay.
And virtual reality, or VR exposure, is super interesting. It uses tech to create realistic simulations. This is great for things where real-life exposure is difficult or unsafe, like fear of flying, as PMC and Psychology Today mention.
VR for phobias, that's fascinating. Now, mindfulness also came up in PMC and Very Well Mind. How does that fit with anxiety treatment?
Mindfulness is about cultivating this non-judgmental awareness of the present moment. For anxiety, especially worry, which PMC calls a kind of mental behavior mindfulness, helps you notice your thoughts and feelings as they arrive without getting swept away by them or judging yourself for having them.
Observing them without reacting.
Sort of, yeah. Creating a little space.
Right.
Things like mindfulness-based stress reduction, MBSR, or mindfulness-based cognitive therapy, MBCT, are often used alongside or integrated into CBT.
Interesting. And Psychology Today and Very Well Mind mentioned a couple of other therapies too, DBT and ACT. How do they compare to CBT?
They're related, but have different emphasis. DBT, dialectical behavior therapy, really focuses on balancing acceptance and change. It teaches skills in mindfulness, distress tolerance, managing emotions, and interpersonal effectiveness. Often used when emotional regulation is a big issue.
Okay. And ACT?
ACT, acceptance and commitment therapy, is more about accepting difficult thoughts and feelings, including anxiety, rather than fighting them. The focus shifts to committing to actions that align with your personal values, even when anxiety is present. So it's less about changing the thought content, more about changing your relationship to the thought and acting based on values.
So several powerful approaches. Very well. Mine also briefly listed others like psychodynamic therapy, IPT, art therapy, group therapy. Any quick thoughts on those?
Sure. Psychodynamic or psychoanalytic therapy often looks deeper into past experiences and unconscious conflicts, typically longer term. Interpersonal therapy, IPT, focuses specifically on relationships and social roles, so it can be really helpful for things like social anxiety.
Okay.
Art therapy uses creative expression to process emotions. More research is ongoing there for anxiety specifically,
Yeah.
and group therapy can be really effective. It provides peer support, you see you're not alone, and for social anxiety, the group itself offers exposure opportunities.
Good to know there's a range of options. Let's switch gears slightly to medications. Mayo Clinic outlined the main types used.
Yes, they mentioned several categories. Certain antidepressants are very commonly used for anxiety, even without depression.
Right.
There's also a specific non-benzodiazepine anti-anxiety med called buspirone. And then in more limited situations, doctors might use things like sedatives, benzodiazepines like Xanax or Valium or beta blockers, usually for short-term relief or specific situations like performance anxiety.
And there are important considerations with meds, right? Mayo Clinic, PMC, Psychology Today all seem to stress this.
Absolutely critical. The short-term nature of some, like benzodiazepines, is key. They have dependence potential and aren't usually a long-term solution. You must have a thorough discussion with your doctor about benefits, risks, side effects.
Makes sense.
And Psychology Today adds an important point. Medication can help lower intense anxiety so you can engage in therapy, but it doesn't necessarily make the therapy itself more effective long-term.
But
And PMC even notes that some anti-anxiety meds, if taken right before exposure therapy, might actually dampen the fear response too much and interfere with the learning process that needs to happen.
that's a really important interaction to be aware of. Now, what about lifestyle stuff? Home remedies, Mayo Clinic had suggestions there.
Definitely. Lifestyle plays a big supportive role. Regular physical activity is a huge one. Great stress reducer, mood booster.
Get moving.
Yep. Also, avoiding alcohol and recreational drugs is important as they can worsen anxiety. Quitting smoking, cutting back on caffeine. Both nicotine and caffeine are stimulants that can ramp up anxiety symptoms.
Oh, wait, what else?
Things like stress management techniques, meditation, yoga, visualization, prioritizing sleep so important for mental health, and eating a healthy diet, focusing on whole foods, fruits, veggies, fish. The direct link to anxiety reduction needs more research, but it supports overall well-being.
Good basics to cover. What about alternative medicine, like herbal remedies? Mayo Clinic touched on that.
Yeah, they mentioned some herbs have been studied, but the big caveat is we need more research on effectiveness and safety.
Right.
And crucially, supplements aren't regulated like prescription drugs by the FDA, so you don't always know what you're getting or if it's safe. Plus, they can interact with other medications.
So talk to your doctor first.
Always, absolutely essential before trying any alternative or herbal remedy.
Okay. Shifting again, what about just coping? Day-to-day strategies. Mayo Clinic had some practical advice.
Yeah, really useful stuff. Learning about your specific disorder is empowering. Sticking to your treatment plan meds, therapy appointments is vital.
Consistency.
Totally.
Yeah.
Identifying your personal triggers and practicing the coping skills you learn, keeping a journal can help track progress and patterns. Joining a support group, NAMI, ADA have them, can make a huge difference, feeling less alone.
Community aspect.
Yes, learning time management can reduce overwhelm, staying socially connected, avoiding isolation, and having strategies to break the cycle when anxiety spikes, like taking a brisk walk, engaging in a hobby.
Those all sound really helpful. Now, how effective is therapy, really, and what's the timeline like? Psychology Today and Very Well Mind sounded quite positive.
They did, and for good reason. Therapy is generally considered highly effective, often the first-line approach. Very Well Mind mentions meta-analyses supporting this across different therapy types.
And the effects last.
That's a key benefit. Psychology Today highlights, the skills you learn in therapy tend to stick with you, providing long-term benefit. Relapse might even be less likely compared to just medication alone.
That's significant.
And it's great news that online therapy is often proving just as effective as face-to-face, making it much more accessible for many people.
Definitely. What about how quickly you feel better? And how long does therapy usually take? Psychology Today had some insights there.
Well, it varies, of course. Some people feel some relief quite early on, but progress isn't always a straight line. There can be ups and downs. Setbacks are normal.
Okay.
Psychology Today suggests significant improvement is often seen within about 20 sessions for many anxiety issues. But it's usually recommended to continue for a while, even after symptoms improve, to really consolidate gains and prevent relapse.
Makes sense. Build resilience.
Exactly.
Yeah.
And because it's skill-based, the positive effects can genuinely last a lifetime.
Psychology Today also mentioned the therapist's role being more than just techniques.
Yes, the therapeutic relationship itself, that feeling of safety, trust, collaboration with a therapist is incredibly important. It helps calm the nervous system and boosts motivation. It's not just what is done, but how and with whom.
That makes a lot of sense. So when should someone actually seek therapy? Psychology Today and very well mind stressed, getting help early.
Yes, very much so. Early treatment is crucial. It can prevent a lot of unnecessary suffering and stop anxiety from becoming more chronic and ingrained.
And untreated anxiety can lead to other problems.
Unfortunately, yes. It can worsen over time, impact quality of life, and increase risks for depression, substance use, physical health problems, and even suicidal thoughts or behavior in severe cases. So ideally, seek help as soon as you feel anxiety is significantly interfering with your life.
Don't wait. And how do therapists track progress? Psychology Today mentions specific ways.
They use their clinical judgment, of course, but also often standardized rating scales, like the Hamilton Anxiety Rating Scale, the HAM-A, which the therapist administers, or self-report scales, like the Zung Self-Rating Anxiety Scale, where you rate your own symptoms.
So objective measures, too.
Right, helps track change over time.
Finally, Psychology Today made a really interesting point about the goal of therapy management, not necessarily a cure. Why is that distinction important?
It's a really key perspective shift. Anxiety itself, at a basic level, is a normal human emotion, even a necessary survival signal.
The fight or flight response.
Exactly. The aim of therapy isn't usually to eliminate anxiety entirely. That's likely impossible and maybe not even desirable. The goal is to develop the skills and understanding to manage it effectively so it doesn't control your life or stop you from doing things you value. Learning to live well with anxiety rather than being ruled by it.
Managing it to a functional level.
Precise.
This has been incredibly helpful, really unpacking anxiety disorders. So just to quickly recap the big points. Diagnosis involves that careful evaluation against DSM-5 criteria, often starting with ruling out physical causes. The main treatments are psychotherapy, especially CBT, and its variations like exposure, cognitive restructuring, mindfulness, and medications, often best used together.
Right, with therapy often focused on long-term skills.
And don't forget lifestyle factors, exercise, sleep, stress management, and support systems. They all play a really important part. And that key goal, therapy, helps you build coping skills to manage anxiety effectively, not necessarily erase it completely.
Well put. And maybe a final thought for you, our listener, to take away from this deep dive. Just consider maybe what's one small step you could take. Perhaps learning a bit more about anxiety or even just thinking about what support might look like for you.
Yeah.
Remember, reaching out, seeking information or help. That's genuinely a sign of strength. It's a proactive step towards feeling better.